Imagine this. You go to bed feeling fine, you drift into sleep, and by morning, your entire life could be different. Every single night, millions of seniors unknowingly put their brain and heart at risk simply by the way they sleep. And here's the shocking truth. The wrong sleeping position can silently cut off blood flow, increase pressure inside delicate vessels, and trigger strokes in the middle of the night. I've seen patients who thought it was just a habit until they woke up with weakness in one arm, slurred speech, or worse, never woke up at all. This isn't about comfort, it's about survival. And if you're over 60, the risk doubles, because aging arteries are far less forgiving. Today, I'll reveal the position you must avoid, the safer alternatives, and the science every senior should know before tonight's sleep. Position number 1. Sleeping on your stomach, prone position. When seniors sleep on their stomach, it may feel cozy, like curling back into childhood, but inside the body something far more dangerous is happening. Lying face down forces the head and neck to twist unnaturally for hours at a time. That twist isn't just uncomfortable. It presses on the carotid arteries in the neck, the main highways that deliver blood to your brain. For someone over 60, these vessels are often already narrower, stiffer, and more fragile because of years of high blood pressure, cholesterol buildup, or diabetes. Add the constant mechanical pressure of stomach sleeping, and blood flow can drop just enough to set the stage for a stroke. The problem doesn't stop there. Stomach sleeping also compresses the chest and diaphragm, which limits how deeply you breathe. Multiple sleep studies, including one published in the Journal of Stroke and Cerebrovascular Diseases in 2019, have shown that shallow breathing at night reduces oxygen levels in the blood. For the brain, oxygen is non-negotiable. Even a mild, repeated dip in oxygen saturation night after night can weaken blood vessels and damage delicate brain tissue over time. What feels like just a habit is actually like starving your brain slowly while you sleep. I once saw a 67-year-old patient who swore that stomach sleeping helped reduce his snoring. He thought it was the healthier choice compared to back sleeping. But when we examined him, we found repeated drops in nighttime oxygen and subtle warning signs of mini-strokes that he never noticed. Then, one morning, he woke up unable to move his left arm, his speech slurred. His position in sleep had been silently increasing his risk for years until one night it tipped him over the edge. This is why doctors get concerned when older patients casually say, "Oh, I've always been a stomach sleeper." It may be harmless at 25, but after 60, the arteries, lungs, and heart don't forgive such mechanical stress so easily. It's like parking a car on a garden hose. At first, the water still flows, but as the hose gets older and stiffer, it collapses faster under the same weight. The body works the same way. Better tip: if you tend to roll onto your stomach, train your body with small tricks. Place a firm pillow under one side of your torso, or wedge pillows on each side of your body to act as barriers. Some seniors even wear a small pouch with a tennis ball on their stomach, which makes lying face down uncomfortable enough to change the habit. Over time, your body learns to prefer side or back positions, both of which protect circulation and reduce the silent stroke risk that stomach sleeping can cause. Position number 2. Sleeping flat on your back without support. Many seniors believe sleeping on the back is the healthiest, almost like the default position the body was designed for. But the truth is, lying completely flat without support can silently create some of the most dangerous conditions for the aging brain and heart. When you lie flat, gravity pulls the tongue and soft tissues in the throat backward, partially blocking the airway. For younger people, the body can usually compensate, but after 60, the muscles of the airway are weaker, the tissues softer, and the airway much more likely to collapse. This leads to sleep apnea, moments where breathing stops entirely. Each time this happens, oxygen levels in the blood fall, and the brain sends out an emergency signal to jolt the body awake just enough to restart breathing. That means your heart is suddenly hit with a surge of blood pressure. Then it falls again when you breathe, then spikes again. Night after night, year after year, this creates a roller coaster effect inside your arteries. Scientists have called sleep apnea a silent stroke trigger because the repeated pressure swings weaken blood vessels and encourage clots to form. And once a clot breaks loose, it can lodge in the brain and cause a devastating stroke that I recall a 72-year-old woman who came to me after months of worsening fatigue. She thought she was just getting old because she woke up with dry mouth, headaches, and sometimes even confusion. She insisted she always slept on her back because she thought it was safest. But her sleep study revealed she was stopping her breathing up to 40 times every night. Each time, her oxygen saturation dipped and her blood pressure spiked. She was unknowingly putting herself through the equivalent of hundreds of mini heart attacks in her sleep. Lying completely flat also increases the risk of acid reflux, because stomach contents can more easily travel back up the esophagus without gravity helping to keep them down. Acid in the throat irritates the airway, makes apnea worse, and fragments sleep further. Over time, this cycle leaves seniors more vulnerable not only to stroke, but also to memory decline, heart arrhythmias, and even dementia. Doctors often underestimate how harmful this neutral position can be. It looks peaceful from the outside, but inside the body it's chaos. Oxygen dropping, pressure surging, acids rising. For seniors, the aging brain is especially sensitive to these nighttime assaults. Each drop in oxygen is like starving the brain for a few seconds, and though you may not wake fully, your brain never gets the deep restorative sleep it needs. That's why so many seniors who sleep flat on their backs complain of constant fatigue, mood swings, or brain fog during the day. The body doesn't recover from the nightly storm. Better tip: if you prefer sleeping on your back, don't do it flat. Elevate your head slightly with a wedge pillow or adjustable bed so your airway stays open and reflux is reduced. Placing a small pillow under the knees also helps keep the spine aligned, taking pressure off the lower back and improving circulation. Seniors who adopt this small adjustment often report deeper, more restorative sleep, fewer headaches, steadier blood pressure in the morning, and far less daytime fatigue. This one change can transform back sleeping from a hidden risk into a position that actually supports your health. Position number 3, sleeping curled up in a tight fetal position. At first glance, curling up tightly on your side feels comforting, almost protective, like returning to the womb. Many seniors over 60 naturally choose this position because it seems to relieve back strain and gives a sense of safety. But when the knees are drawn too far toward the chest and the chin is tucked deeply down, the body is placed in a posture that can silently harm circulation and strain both the spine and lungs. In this curled position, the diaphragm is compressed and cannot expand fully, which restricts deep breathing. That means less oxygen flows into the bloodstream. And just like with apnea, the brain suffers from repeated oxygen shortages. Studies from sleep medicine journals show that chronic shallow breathing during curled sleep can reduce oxygen saturation levels by up to 10%, a drop significant enough to impact heart and brain health over time. The other danger is spinal alignment. With the neck bent forward and the back unnaturally rounded, nerves can be pinched and blood vessels constricted, especially in seniors who already have arthritis or spinal disc thinning. Over months and years, this tight curling can increase the risk of nerve pain, numbness in the arms or legs, and even elevated nighttime blood pressure as the body struggles to compensate for poor circulation. I remember one patient, a 69-year-old woman, who came in complaining of waking up with tingling in her hands every morning. She thought it was carpal tunnel, but in reality her severe fetal sleeping posture was compressing nerves and reducing blood flow to her arms throughout the night. When she adjusted her sleep position, the tingling disappeared, and her morning blood pressure readings improved within weeks. This is the hidden cost of a position that feels cozy, but is in fact dangerous for seniors when it becomes too extreme. Better tip: if you prefer side sleeping, avoid tucking too tightly into a ball. Keep your legs slightly bent rather than fully curled, and place a pillow between your knees to keep your hips aligned. A supportive pillow under your head should keep the neck straight rather than bent downward. This modified side position still feels comfortable and safe, but allows your lungs to expand, your spine to stay aligned, and your circulation to remain steady through the night. Position number 4, sleeping upright in a recliner or propped with too many pillows. Some seniors develop the habit of sleeping upright in a recliner chair or stacking so many pillows under the head that the body is almost sitting. At first, this feels helpful, especially for those with heartburn, chronic cough, or breathing problems. But in reality, it creates a new set of dangers. When the head is pushed forward and the body bent at the waist, the blood vessels in the neck are placed under unnatural tension. This can reduce blood flow to the brain and increase stiffness in the cervical spine, which already becomes more fragile with age. A study in the Journal of Geriatric Cardiology found that seniors who slept in sharply inclined positions had higher nighttime blood pressure variability, a known risk factor for stroke. On top of that, sleeping semi-upright often leads to poor circulation in the legs. Gravity pulls blood downward, and without the natural movement of muscles to pump it back, fluid begins to pool in the lower extremities. This can cause swelling, restless legs, or in more severe cases, increase the risk of blood clots in the veins. I once worked with a 74-year-old man who thought his recliner was the only place he could sleep comfortably after meals. Over time, he developed chronic swelling in his ankles and shortness of breath at night. Tests revealed that the pooling of blood from his upright posture was straining his heart and contributing to dangerous nighttime spikes in blood pressure. Instead of protecting his health, his recliner habit was quietly putting him at higher risk of both stroke and heart failure. Many seniors don't realize that the body needs to be horizontal for the heart and brain to rest properly. Without that alignment, circulation is constantly fighting against gravity, and the brain never fully benefits from the deep, restorative stages of sleep. Better tip: if you must elevate your head for reflux or breathing, use an adjustable bed or a firm wedge pillow that raises the upper body gradually rather than sharply. This keeps circulation smoother, prevents pooling in the legs, and maintains a healthier angle for the neck and spine. Seniors who switch from recliners to properly supported beds often report less swelling, improved morning energy, and far fewer nighttime awakenings. Position number 5. Sleeping on one side without proper support. Side sleeping is often seen as the gold standard for seniors because it helps reduce snoring and can ease breathing, but when done without proper support, it can quietly create health risks that accumulate night after night. The first problem is spinal misalignment. When someone lies on their side without a pillow between the knees, the top leg pulls downward, twisting the spine and hips. For younger adults, muscles may correct for this, but in seniors, where joints are stiffer and arthritis is more common, this twisting can lead to nighttime pain, nerve compression, and disrupted circulation in the lower body. Over months, this habit can even worsen hip or lower back arthritis, leaving seniors waking up sore and fatigued. Another issue is pressure points. Lying on one side concentrates body weight on the shoulder and hip, which can compress nerves and blood vessels. I remember one 70-year-old patient who complained that she woke every morning with tingling in her fingers and an aching shoulder. She was terrified she had nerve disease, but after examining her sleep posture, we discovered the culprit. Every night, she was compressing her brachial plexus nerves by lying directly on her shoulder without support. Once she added proper pillows, the tingling disappeared within weeks. There's also the problem of always sleeping on the same side. The body is not designed for asymmetry, and night after night of favoring one side can worsen issues. Research from the American Journal of Gastroenterology shows that sleeping on the right side increases nighttime reflux because the stomach sits higher than the esophagus in that position, allowing acid to flow upward. Seniors with reflux who habitually sleep on the right side often wake with sore throats, chronic coughs, or even chest pain that feels like a heart attack. On the left side, reflux is reduced, but the shoulder joint is under more strain if there's no supportive pillow. That strain can cause bursitis, chronic shoulder pain, or even frozen shoulder in older adults. In addition, prolonged side sleeping without rotation may reduce lung expansion, especially if the torso is curled too tightly. This can limit oxygen intake and create shallow breathing patterns that deprive the brain of the oxygen it desperately needs during deep sleep. When the brain gets less oxygen, blood vessels become more vulnerable, and the risk of nighttime stroke rises. What feels like this safe position for sleep, when done improperly, can in fact quietly contribute to long-term circulation problems, digestive discomfort, and reduced brain protection. Better tip: if you prefer side sleeping, give your body the support it needs. Use a firm pillow that keeps your head aligned with your spine so the neck doesn't bend downward, and always place a pillow between your knees to prevent twisting at the hips. If you struggle with reflux, favor the left side rather than the right, and alternate sides through the night instead of always lying on the same one. Seniors who make these adjustments often notice fewer morning aches, better digestion, reduced nighttime coughing, and more energy during the day. With just a few small changes, side sleeping can transform from a risky habit into the healthiest position for circulation, digestion, and brain health. Position number 6. Sleeping with the head tilted too far forward or sideways on a bad pillow. It may sound surprising, but the wrong pillow and the way it positions your head can be just as dangerous as the sleeping posture itself. Many seniors, over 60 years old, worn out pillows that have lost their support, or they stack thin pillows in a way that bends the neck too far forward or sideways through the night. When the head is tilted unnaturally for hours, the cervical spine is strained, and more importantly, the vertebral arteries that run along the spine into the brain can be partially compressed. This reduces the flow of oxygen-rich blood to the back of the brain, the very region that controls balance, coordination, and vision. That's why poor pillow support has been linked in clinical sleep studies to higher risk of dizziness, nighttime headaches, and even mini-strokes. I once had a 68-year-old patient who thought her morning migraines were due to stress. But after examining her sleep posture, we discovered her pillow was collapsing under her head each night, pushing her chin downward and cutting off blood flow through her neck. Once she replaced it with a supportive cervical pillow, the migraines faded within weeks. Another hidden issue is airway obstruction. When the head tilts too far forward, the throat narrows, increasing snoring and sleep apnea episodes. These small interruptions may seem harmless, but as I explained earlier, each apnea event spikes blood pressure and starves the brain of oxygen. Over time, this can contribute to memory decline, vascular damage, and increased stroke risk. Worse, pillows that are too high or too firm can also kink the neck sideways, leading to nerve compression. This is why so many seniors complain of waking up with stiff necks, tingling in the arms, or even numb fingers. They think it's arthritis, but in many cases it's simply the effect of a poor pillow disrupting circulation and nerve function. Night after night, it may not sound as dramatic as sleeping on your stomach or sleeping in a recliner, but the truth is that head position plays a huge role in protecting brain health while you sleep. The brain depends on a steady, unobstructed supply of blood and oxygen, and even small changes in head angle can interfere with that flow in seniors whose arteries are already narrower and less flexible. Better tip: always invest in a pillow that supports the natural curve of your neck and keeps your head in line with your spine, whether you sleep on your back or side. Cervical pillows or memory foam options are excellent choices for seniors because they prevent the head from tilting forward or sideways. Replace pillows every 18 to 24 months, since old pillows lose their shape and stop providing proper support. Seniors who upgrade their pillow often report fewer headaches, less snoring, deeper sleep, and sharper mental clarity in the morning. It's a small change that can make a life-saving difference. We've now uncovered 6 of the most dangerous sleeping positions for seniors over 60, each one silently raising the risk of stroke, high blood pressure, or nighttime oxygen loss. What may feel like comfort, habit, or even doctor-approved decades ago can, with age, become a hidden threat to your brain and heart health. But the good news is that small changes make a huge difference. Adjusting a pillow, slightly elevating your head, avoiding the stomach posture, or supporting your hips and knees. These are simple steps that can transform the quality of your sleep and protect you from life-changing events like a stroke. Remember, sleep is not just about rest. It's when your brain clears toxins, repairs blood vessels, and prepares you for another day. Seniors who protect their sleep position protect their future. And now I want to hear from you. Did any of these sleeping habits surprise you? Do you recognize yourself in one of these risky positions? Share your thoughts in the comments below. I read every one of them. And if you found this helpful, subscribe for more senior health tips that could save your life.